Uterine fibroids are a common occurrence for many women. These growths can be a source of concern, but understanding them can help alleviate some of the anxiety. They are non-cancerous growths that develop in the uterus. These growths are composed of muscle cells and other tissues that form a mass within the uterine wall. Think of them like small, hard balls made of muscle cells and other tissues. These fibroids can vary greatly in their composition and structure. These growths can range in size from tiny seeds to bulky masses. Some fibroids can be so small that they are undetectable by the human eye, while others can grow large enough to distort the shape of the uterus. While they are called tumors, uterine fibroids are benign, meaning they are not cancerous. This is a crucial point to understand, as the term tumor often brings to mind the fear of cancer. This is an important distinction, as many women fear the worst when they hear the word tumor. Knowing that fibroids are benign can provide significant relief. Rest assured, fibroids are not linked to cancer and do not increase your risk of developing cancer in the future. This reassurance is vital for peace of mind. The exact cause of uterine fibroids is still unknown. Despite extensive research, the medical community has yet to pinpoint a definitive cause. However, researchers believe that hormones, particularly estrogen and progesterone, play a significant role in their development. These hormones are known to stimulate the growth of fibroids. This is why fibroids often appear during a woman's reproductive years when these hormones are at their peak. The fluctuation of hormone levels during this time can contribute to the growth of fibroids. It's important to remember that having uterine fibroids is not uncommon. Women from all walks of life can develop fibroids, and it is a widespread condition. In fact, up to 80% of women will develop fibroids at some point in their lives. This statistic highlights just how common fibroids are among women. Many women with fibroids experience no symptoms and are unaware of their presence. Often, fibroids are discovered incidentally during routine pelvic exams or imaging tests for other conditions. For those who do experience symptoms, they can vary widely. Some common symptoms include heavy menstrual bleeding, prolonged periods, pelvic pain, and pressure. Other symptoms might include frequent urination, difficulty emptying the bladder, and constipation. The location of the fibroids within the uterus can influence the type and severity of symptoms. Submucosal fibroids, for example, grow into the uterine cavity and can cause significant bleeding and reproductive issues. Treatment options for fibroids vary depending on the size, number, and location of the fibroids, as well as the severity of symptoms. Some women may require medication to manage symptoms or to try to shrink the fibroid, while others might need surgical intervention. Other options include uterine artery embolization, where the feeding blood vessels supplied to the fibroids are blocked to shrink the fibroids. High radiofrequency energy destruction of the fibroids is a new technique in suitable patients. Surgical options include myomectomy, which is the removal of fibroids while preserving the uterus, and hysterectomy, which is the removal of the entire uterus. The choice of treatment should be made in consultation with a healthcare provider, considering the individual's specific circumstances and future reproductive plans. Support and education are crucial for women dealing with fibroids. Connecting with others who have similar experiences can provide comfort and valuable insights. Educating oneself about fibroids and staying informed about the latest research and treatment options can empower women to make the best decisions for their health. Remember, while uterine fibroids can be a challenging condition, they are manageable. With the right information and support, women can navigate this condition with confidence and peace of mind. What types of fibroids exist based on their locations within the uterus? Uterine fibroids are categorized based on their location within the uterus. This classification helps doctors understand how a fibroid might affect a woman's health and guide treatment decisions. Intramural fibroids. These are the most common type and grow within the muscular wall of the uterus. They can expand, making the uterus feel larger than normal. Subserosal fibroids. These fibroids grow outward from the uterus, pushing into the pelvic cavity. They can sometimes grow quite large and press on nearby organs like the bladder. Submucosal fibroids. These fibroids grow into the uterine cavity, the space where a baby develops during pregnancy. They can cause heavy menstrual bleeding and fertility issues. Pedunculated fibroids. These fibroids grow on a stalk, like a mushroom. They can be either subserosal or submucosal. The size and location of a fibroid greatly influence the symptoms a woman may experience. Some women may have large fibroids with no symptoms, while others may have small fibroids that cause significant discomfort. Many women with uterine fibroids experience no noticeable symptoms, especially when the fibroids are small. These benign tumors often go undetected during routine medical checkups and may not cause any discomfort or health issues. However, it's crucial to be aware of the potential symptoms as fibroids can grow over time. However, as fibroids grow larger, they can cause a range of symptoms that vary from woman to woman. The severity and type of symptoms depend on the number, size, and location of the fibroids within the uterus. Some women may experience mild discomfort, while others may face more severe and disruptive symptoms. One of the most common symptoms of uterine fibroids is heavy menstrual bleeding. This symptom can significantly impact a woman's daily life and overall well-being. Heavy bleeding can lead to anemia, causing fatigue and weakness, and may require medical intervention to manage. This can range from slightly heavier periods to excessively heavy bleeding that requires changing pads or tampons every hour. Women may also experience prolonged menstrual periods lasting more than a week, which can be both physically and emotionally draining. Fibroids can also cause bleeding between periods, known as intermenstrual bleeding. This unexpected bleeding can be alarming and may lead to concerns about overall reproductive health. It's important to track any irregularities in your menstrual cycle and discuss them with your healthcare provider. Pelvic pain and pressure are other common symptoms. This discomfort can range from a mild, persistent ache to severe, debilitating pain that interferes with daily activities. The pain may be localized to the lower abdomen or radiate to the lower back and thighs. Women may feel a dull ache, a feeling of fullness, or sharp stabbing pains in their lower abdomen. These sensations can be constant or intermittent, and they may worsen during menstruation or physical activity. Large fibroids can press on the bladder, causing frequent urination, or on the rectum, leading to constipation. This pressure can create a sense of urgency to urinate or difficulty in passing stools, further complicating a woman's daily routine. Other potential symptoms include pain during intercourse, which can affect intimate relationships and emotional well-being. Lower back pain, which can be persistent and affect mobility. Abdominal swelling, which can cause discomfort and self-consciousness about one's appearance. Reproductive issues such as infertility or miscarriage. Fibroids can interfere with the implantation of the embryo or the growth of the fetus, leading to complications during pregnancy. Women trying to conceive may face additional emotional and physical challenges due to fibroids. It's important to remember that these symptoms can also be caused by other medical conditions. Conditions such as endometriosis, pelvic inflammatory disease, and ovarian cysts can present similar symptoms, making it essential to seek a professional medical evaluation. If you experience any of these symptoms, it's essential to consult with your doctor for a proper diagnosis. Early detection and treatment can help manage symptoms and improve quality of life. Your healthcare provider can recommend appropriate diagnostic tests, such as ultrasound or MRI, and discuss potential treatment options tailored to your specific needs. How do doctors diagnose uterine fibroids? Diagnosing uterine fibroids typically involves a combination of medical history, physical examination, and imaging tests. Your doctor will first ask about your symptoms, including the heaviness of your periods, any pain you're experiencing, and your medical history. A pelvic examination is usually the next step. During this examination, the doctor will feel your abdomen and pelvis to check for any abnormalities in the size, shape, or position of your uterus. This can help identify any large fibroids. To confirm the diagnosis, your doctor will likely recommend imaging tests. Ultrasound is a common and non-invasive imaging test that uses sound waves to create pictures of your uterus and ovaries. It can detect the presence, size, and location of fibroids. In some cases, other imaging tests like magnetic resonance imaging or MRI may be used to provide a more detailed view of the fibroids, especially if surgery is being considered. These tests help your doctor determine the best course of treatment for your specific situation. What complications might uterine fibroids cause? Fibroids are non-cancerous growths of the uterus that often appear during childbearing years. While they are generally benign, their presence can sometimes lead to significant health issues. While most uterine fibroids are benign and don't cause serious problems, in some cases they can lead to complications that require medical attention. These complications can vary in severity and impact, depending on the size, number, and location of the fibroids. One potential complication is anemia, a condition caused by a lack of red blood cells. Anemia can result from heavy menstrual bleeding, which is a common symptom of fibroids. This excessive bleeding can deplete the body's iron stores, leading to iron deficiency anemia. Heavy bleeding caused by fibroids can lead to iron deficiency anemia, leaving you feeling tired, weak, and short of breath. Symptoms of anemia can also include dizziness, headaches, and pale skin. Managing anemia often involves taking iron supplements and making dietary changes to increase iron intake. Large fibroids can also press on nearby organs, leading to discomfort and other issues. The size and location of the fibroids can cause a range of symptoms, from mild discomfort to severe pain. Pressure on the bladder can cause frequent urination or difficulty emptying the bladder completely. This can lead to urinary tract infections and other complications if not addressed promptly. Pressure on the rectum can lead to constipation and discomfort during bowel movements. This can be particularly distressing and may require medical intervention to manage effectively. In rare cases, fibroids can interfere with pregnancy. They can affect fertility and pregnancy outcomes, depending on their size and location within the uterus. During pregnancy, they often grow bigger because of pregnancy hormones, and due to this, they may outgrow their blood supply, leading to what is called fibroid degeneration, a condition that causes significant pain in pregnancy. Submucosal fibroids, which grow into the uterine cavity, can make it difficult for a fertilized egg to implant or increase the risk of miscarriage or preterm labor. These fibroids can also cause complications during delivery, potentially necessitating a cesarean section. It's important to note that not all women with fibroids will experience complications. Many women live with fibroids without any significant issues, and some may not even be aware they have them. However, it's crucial to be aware of the potential risks and seek prompt medical attention if you experience severe pain, heavy bleeding, or other concerning symptoms. Early diagnosis and treatment can help manage symptoms and prevent complications, improving your overall quality of life. Regular checkups and open communication with your healthcare provider are key to effectively managing fibroids and maintaining your health. Thanks for watching, and if you found this video helpful, be sure to like, share, and kindly subscribe to our channel. Allow us to continue to make more content like this one.